welcome all of you joining from all around the world. And we are truly impressed having people joining from different time zones at a very early hour and also staying up very late. During our event today, under the theme Preparedness for Pandemics, Shaping Future Research, Communication and Informed Public Health Decision-Making, we would like to provide a space to reflect on what we learned in the current pandemic, but most importantly, to look ahead and to critically discuss future research needs, how we as scientists can improve our support for decision makers and the public, further develop our communication and learn as a society. For our program today, we are very honored to get insights from decision-making bodies, starting with the Director of the European Center for Disease Prevention and Control, Dr. Andrea Ammon. But also, we are looking forward listening to the WHO perspective from Professor David Naborro. In the Symposium on Future Preparedness for Outbreaks, Epidemics and Pandemics at 3:15, we bring together experts in bioethics, equity, research, law and health technology assessment, working or informing national decision-making bodies, as well as European Commission, and of course, your experiences, thoughts and visions as participants with diverse backgrounds joining a lively discussion. The goal of this meeting is also to provide opportunities for continuing education for our multidisciplinary membership, first-time attendees, and friends of SMDM. The recent months vividly showed how communication impacts decision-making, positively and negatively, and that in our highly networked world, we may need to rethink your communication strategies and carefully think about the audience, the public, patients, decision makers, or scientists, about their needs and concerns, and the overall goal to improve health. We are very thankful for the support of the SMDM Special Task Force on Risk Communication, led by Ashley Houston, for setting up an amazing workshop, Risk Communication, Communicating Science to Non-Scientists, which focuses on the communication of values and trade-offs. The workshop includes perspective of communication experts, scientists, and journalists, and provides a space for learning together in small breakout groups starting at 5 p.m. During the event, we will ask the audience to stay muted and enter your question in the chat. We will have chat moderators to collect and merge questions. We hope that our event will inspire you, invigorate and energize your thinking, research, teaching, and leadership, taking responsibilities and driving new activities. Please also join our social event at 6:30 CET in WonderMe. We will provide the link in the chat, and you also already received it via email. Use the great opportunity to walk visually around, mix with new people, or meet long-term friends or new attendees in small conversations of your choice. Finally, I would like to thank all speakers, the entire organizational team, and the SMDM board for many valuable suggestions, making this event a truly interdisciplinary and international event. With this, I turn it over to Natasha Stout, President of SMDM.
Hello, everyone. I'm Natasha Stout, the current President of SMDM. And on behalf of the board, I'd also like to welcome you to this very special European virtual event. Beata, Silke, Tobias, and Uwe, our program chairs, have put together a great agenda for us, led by policymakers, stakeholders, and academics from around the world. Since we haven't been able to meet in person, I'm thankful for this wonderful opportunity for all of us to come together to learn, debate, discuss methods and policies, and of course, to connect and network with each other again. It's one example of the kind of opportunities that SMDM has been working on to bring us together throughout the year. And that, of course, has not been easy during a pandemic. Earlier this year, for example, we learned from the COVID-19 decision modeling initiative teams who've been actively involved in shaping vaccine, treatment, prevention, and mitigation policies around the world. And if you missed it, please check out the SMDM website. Later this summer, we'll be offering educational opportunities with several methods-related short courses. And of course, this fall, we'll all have the opportunity to share our research and learn and connect with each other again at our virtual meeting in October. And in fact, scientific abstract submissions are due in about 15 hours, so there's still time to get yours in if you're interested. But even if you don't submit an abstract, I hope to see you there. Lastly, on behalf of SMDM, I'd like to extend a huge thank you to the meeting chairs for their hard work in organizing not only this meeting today, but also 2 other SMDM European meetings, one of which had to be postponed in 2020, and the other, hopefully in person, is planned for next summer. So please join me in thanking them for their tremendous efforts. With that, I'm really looking forward to the sessions today, and over to you, Silke.
Thank you so much, Tasha, for these welcome words. Silke.
Yeah, thank you, Tasha, and thank you, Beate. Hello and welcome also from my side. I'm so happy to see you all here in our Zoom room. And yes, as Tasha had said, we had worked so hard to organize a fantastic European meeting in Berlin for 2020. You all know why we had to postpone it to 2021. Actually, it would have been today. And so we postponed it again to 22. And now please mark your calendar for May 29 to 31st in 2022. And then I hope we can all be there and celebrate in Berlin in person. But now please enjoy our wonderful spring event with all our fantastic speakers. I hand over to Tobias.
Yeah, thank you very much, Silke. A warm welcome from Berlin, sunny Berlin today. So would have been a great time to meet, but unfortunately, as you know, that is not possible. I would like to thank my co-chairs and the entire organization to preparing this meeting. It's really exciting that we managed to get such a wonderful group of people together. We would like to encourage you, the audience, to really write down your questions in the chat and work with us, and also don't sit too long, also get up sometimes and stretch a little bit. We all are used to Zoom meetings, I assume, but nevertheless, sometimes we forget to move a little bit. So if you have a chance during the next hours, also do this a little bit, but listen and hopefully discuss with us. We're looking forward for this session. And I hand it over to Uwe.
Thank you very much, Tobias. Also, thank you for your help in setting up everything for Berlin 2022. I'm really thrilled about the panel of speakers we were able to put together. And I'm extremely thankful to each of our speakers and to all of you coming in today for taking the time out of your busy days to shape this event together. Also, thanks to our president, Tasha Stout, to Diane Nicholson from SMDM, to Teresa Bellman from PMA, and to Christina Kanelopoulos from UMIT for their continuous support in all the preparation of this event, which went until yesterday. And particularly a huge thank you to you, Beate and Silke, who did the heavy lifting and the scientific preparation and the coordination of our events today. I'd also like to acknowledge our university, UMIT, which hosted the 2010 meeting and again gave us the resources and time to prepare this meeting today. So I wish you all a fruitful event and lots of inspiring thoughts, exchange, have fun, enjoy the meeting. It's now my great pleasure and huge honor to introduce our keynote speaker, Dr. Andrea Ammon, the director of the European Center for Disease Prevention and Control, ECDC. Andrea, welcome to the world of the Society for Medical Decision Making and friends. Andrea is a physician by training. She received her doctoral degree from the University of Munich. Her early scientific focus was actually on quality of life of patients. She also holds a Master of Public Health from the University of Munich. And it was actually at that time, decades ago, when I first met her. She was 1 year ahead of me in the Munich MPH program. Prior to joining the ECDC, Dr. Ammon served in several roles at the Robert Koch Institute in Berlin. She was head of the department there for infectious disease epidemiology, and in this capacity, she maintained and further developed the German national surveillance system, coordinated national outbreak responses for infections, and included also the emergency plans for influenza. She also directed educational programs, and she was like this the field epidemiology training program, and also epidemiological research programs in infectious diseases. She provided scientific advice for government ministries, members of parliament, and the public. Dr. Ammon joined the ECDC as the head of the surveillance unit in 2005. That unit was responsible for developing the European surveillance systems, TASI, they're called, implementing a long-term survival strategy for the European Union, also evaluating the so-called dedicated surveillance networks, DSN, performed step-by-step transfer from these activities to the ECDC, and also revising the European case definitions and annual reporting on infectious disease to the European Union. Between 2011 and 2005, she was deputy to the ECDC director and the head of the unit for research management and coordination. You see all that experience that comes together for a job like we have today. And in 2015, she was appointed ECDC's acting director, and since 2017, she is the director of ECDC. And today, she is with us at our European Spring event. And let me see whether she is between two other meetings. So she has a very tight time schedule. Andrea is in the Zoom, but I don't see her yet, sitting on her chair. So Andrea, if you hear me, the Zoom floor would be yours. I see you coming in. Andrea, thanks again. It's such a touchy moment for me, having you seen when we still were students in MPH in Munich. And I think the last time was when the MPH program celebrated the 15th anniversary. This was also some time ago. And I hand over the floor to you. You can unmute and welcome to our society and have the floor for your keynote. Thank you so much, Andrea, for joining us.
Okay, so I'm working out the technicalities here. Otherwise, I am fine. Thank you very much, Uwe. And I share my screen. Yeah, and that's the presentation. Yeah. FG? Well, it doesn't. Yeah, but I haven't seen it. So, thank you very much. I am really pleased to be here, and we had a good meeting at the beginning at the preparation where I explained why I was so keen actually coming to this conference. I have given it the title "Lost in Translation" because that is something that in connection of science and public health decision making in the past 1.5 years is very close in my thoughts. The starting point for this is the ECDC vision, because in this vision you will see how our plan for the next 7 years is already connected to the link and the bridging between science and policy. Our vision is to improve lives in Europe and globally, applying scientific excellence, thus empowering the member states, the European Commission, and other partners to drive public health policy and practice. So here we have already our vision that ECDC is an institution that helps decision makers to understand science and turn it into public health policy and practice, and change practices according to the scientific developments. Now, where are those challenges and links where there could be a translation that could be missed? Is, of course, the general difficulty sometimes for science on scientific experts to communicate the scientific findings to policy makers and decision makers. Here in this past situation, we had the additional elements that we had a new virus. We had a situation that we all had to get used to. Once we got used to towards the end of last year, the variants came up, added another dimension of complexity, and now we have also the vaccines that add another element that is positive, but it still is another element. Now, the other aspect was that the difficulty of policymakers and scientists to talk to the public. And here, that's also sometimes, it's not unusual, but here, of course, also a very important element, because of the importance that the public understands what's going on and why they have to live with their the restrictions that they had to face during the past 1.5 years. And on top of this, it was basically the uncertainty. So, and now I'm stuck here. I try the keyboard. I do not think this is very helpful here. Okay. So you saw the uncertainty. A few words about ECDC. We are an EU agency located in Sweden. We have 326 employees, where 46 of those were allotted and assigned only to us this year. So until the whole last year, we had to work with 280 staff. We have 26 of the 27 EU nationalities, and our core functions built from the mission to identify, assess, and communicate risks, public health risks from emerging or existing infectious diseases. We do not have risk management capacities, meaning that we cannot tell the member states what to do. We can just come out with options for response. Now, in the past years, we had a number of public health emergencies. And the first one on the bottom, H5N1 avian influenza, came to Europe in the year when ECDC started its work. So we are basically in operation since 2005. And a few months after we started with let's say 20, 25, 30 staff on board. Avian influenza came to Europe, and everybody expected that we, as the European Center for Disease Prevention and Control, would manage that, which of course was like flying a plane while building it. So from this experience, we went on the pandemic in 2009, H1N1 was sort of a bit the contrary to what we see now, because here everybody expected a very serious event that turned out quite mildly, where here in COVID, it was a bit the other way around. You see in 2012 another coronavirus, the MERS coronavirus, where we had few imported cases. I mean, all of these would be the Ebola in 2014, Zika, the plague in Madagascar in 2017, where it luckily remained. We didn't have any imported cases. In 2018, the flare-up in the Democratic Republic of Congo of Ebola were special things in which I will not go into. Now, here we had some challenges. And all in all, I can already say that COVID-19 was our biggest test. For us here at ECDC, it was the sheer volume of work, the pressure, the fact that we have been on the spotlight from the beginning, and the uncertainty that I already mentioned, of course, and the mismatch of the expectations to us versus what we actually could do. Member states, of course, had their own challenges, and what we saw is that they had difficulties in ramping up their surveillance for this new disease, in ramping up their hospital capacity. There were challenges due to the shortage of medicines, materials, and equipment. And the global challenges are still present, of course, where we see how difficult it is to, for instance, equitably distribute the vaccines. And it was very clear also that the different parts of the world were not affected at the same time, in the same way, which of course would have allowed for learning from each other, which we tried, which was not so easy in the end. So now, what did we do? This is our science for action. You see here just some snapshots of the material that we produced. We did basically from the beginning our risk assessments, which of course were hampered by what we knew, so the scientific evidence on which we usually base our risk assessments. It gradually came on, but at the beginning it was more drawing on analogies to other coronaviruses than really based on the evidence and the facts about this new coronavirus itself. Of course, these facts came along, became known after time went on, and we updated our risk assessments many times. You see here on the right side the latest risk assessments that are mainly dealing with the variants, and I think our next update that comes out this week is the 15th update in 1.5 years. But you see also here on the left side that we have a lot of infographics. So we tried to simplify the content, and these infographics and other material that I will show you later are among the most downloaded outputs on our website. But the absolute best and most accessed parts are our data. So the data that we collect, that we present in very different ways, daily, for instance, what we gather via our epidemic intelligence, weekly, more analytical reports per country, where we show the trend per country. We have now 3 different dashboards, one about all cases and deaths, one just with the variants, and one for the tracking of the vaccine progress. I would like to dedicate a bit also to the vaccination, because here is a very important area where the support to decision makers is crucial. Here, the establishment of good communication, so that good and high vaccination uptake is achieved, is just of pivotal importance. So we have worked on aspects of prioritizing the population for vaccination, because it was clear that we would not have enough vaccines to vaccinate everybody, let alone that not everybody could be vaccinated at the same time anyway. And then we have now reported since the beginning of the year how countries actually are rolling out, what the difficulties they face. Now here on the right side, you see a picture of our vaccine tracker. There are different tabs here. The doses distributed, the doses administered. You see we are over 250 million vaccinated people in the EU now. And this week, latest next week, we will have 50% of the population in the EU over 18 with at least 1 dose of vaccine. But that might not actually keep. So, and if I can go back now, previous. So that is in terms of the risk communication, what I wanted to show you our efforts. So we do have, as I said, a number of infographics that should help reducing complex guidance documents into simple pictures and messages, which we find is very important for understanding both of policymakers, but also of lay people. We have a number of videos here for the how you wear a face mask, easy messages why and when you should have a face mask, and the proper hand washing. As this is key elements in our view, where people could be empowered actually to feel that they can do something themselves to control the pandemic. Overall, in our understanding is that the very important aspects of risk communication is that people understand, that people trust the message, and that it's well, the messages are conveyed so that they do understand. So we did, of course, enhance our social and traditional media activities. And when I say enhance, it's just unbelievable what happened. In 2019, in the year before the pandemic, we had in the whole year 90 media requests, 90. Last year, it was close to 2,000. So it was an enormous increase. As of March last year, I decided also to take many of these media requests myself, seeing that the political sensitivity increased, and also to try to streamline the messaging. We used a lot of the infographics for our social media activities, and they were actually very much taken up. The other element that we introduced in order to improve our translation to policymakers is this policy brief, where every week we summarize in a document the epidemiological situation, with maps and graphs, but also explain certain focus elements that are relevant for a certain week, and give an overview what we have published and what we are going to publish. And that is distributed to the commissioner, to our health commissioner, her cabinet, and the director general, our management board. These are for us the most important the decision makers that we interact with. And I know that this policy brief within the commission is distributed through all directorate generals. So in that sense, it was quite a positive work, and I think now we have to see how we can keep it in an understandable way, because with adding the variants and with adding the vaccination, it has a tendency to slip over to more the scientific jargon. A very important tool for us is a portal that we launched last year. It was basically unnoticed. Otherwise, we would have made a huge event out of it. It's the European Vaccination Information Portal. It is, as you available in all official languages, and it is dealing with most of the vaccines, but since the end of last year, we have started also to put something for the COVID-19 vaccines, in order to create a central place for the EU, where trusted information is available for citizens, for healthcare professionals, and for anybody who actually wants to have information about vaccines. And that is one of the elements that we keep quite updated, in order to prevent what's already happening, the misinformation and disinformation on vaccines, where we also towards the end of the month bring a report to where we have sort of researched a bit the reasons in different countries, actually in 6 countries, which could prevent people from taking up the vaccines, because we are right now seeing a steady progress in the vaccination. but we have or are getting signals that this might come to an end, because the people who actually are willing to take the vaccine are now almost all vaccinated. It is very clear that we cannot do this alone, and we have not worked alone. On the left side, you see our partners within the EU bubble, with other agencies, with the Council, with the European Parliament, and with the Commission. And the past 1.5 years were marked by the fact that we had new cooperations coming up. We have worked with, for instance, the transportation agencies for airplanes, for rails, for cruise ships, to ensure the safety on their vessels. We have worked with the specific agencies, and I can tell you, I have never had so much contact with the Council of Ministers like in the past 1.5 years. Also for the European Parliament, where we have a fairly intense collaboration since ever I took up this office. We had now also new committees coming in. On the right, WHO, you see other CDCs, the neighboring countries, NGOs, and here it was quite remarkable. We have collaboration agreements with the CDCs across the world, with China, with Africa, with Canada. But now we have a much higher interest also from other parts of the world, like from South America, from other parts in Asia, like Singapore, Japan, and South Korea, where we have, since the past year, on a regular basis, meetings to exchange views and also practices. So all this, you have probably heard, has resulted in a new legal proposal for a revision of our mandate. And this mandate revision tries to take up the lessons that we have learned. So the difficulties in getting timely, comparable data of good quality from member states is due to the fact that the current surveillance systems are too time consuming, and we need to work on a more digitalized system at the EU level, but also at member state level. Preparedness and response planning and reporting has to be strengthened. The proposal foresees still provision of non-binding recommendations and options for risk management, although I understand that the countries are not too keen to take this on board. It foresees that we keep a dedicated health task force that can be deployed in EU, but also outside of EU countries, to support in crisis and in non-crisis times with the provision of support to preparedness. We should establish a network of EU reference laboratories and also have a wider global reach. So the conclusion is there are some lessons that we learned. One is, and that's my very personal, absolute lesson number one, we have to learn the lesson this time. We did lessons learned after Ebola, after the flu pandemic in 2009, but we didn't learn the lessons. So this time we really have to do it and take some action. We have paid, secondly, the price for disinvestments in public health. health systems in general, but in particular in public health. And I think everybody should have recognized that investments in public health is really an investment and not a cost. The improvement of surveillance and preparedness is quite obvious for, I think, all involved. The question is, how do we do it? How quickly can it be done? How much investment will be possible for this? I mentioned, maybe I didn't mention, but the engagement is a component of the preparedness plans that were not very much present, and which we need to enhance, so that the population is basically a part of the control effort and not just the receiver of measures that they may or may not understand. And lastly, we have to embrace collaboration. This is a crisis, and it became very evident that no country can do this by itself. And not even a region, I would assume, because it's global, and only if we all work together, we can also control it in the end. And for which of these components do we need a better translation? Well, for all of them. So I think this is sort of kind of closing the loop, and I'm happy to take questions. Thank you.
Thank you so much, Andrea, for this lively presentation and all the organizational, but also the details of the communication work at ECDC to lay people, what you call translation. Thanks also for your comprehensive perspective on this topic. And I very much hope that your messages regarding investments in public health are heard by those making these investments. Let me start with first questions, and then I've seen we have a few questions in the chat, and Dr. Ursula Rochau from UMIT will check if you have questions and propose them to me. Let's try to keep questions and answers short so we can cover several. You mentioned two elements that are so central to decision making. You very strongly focused on uncertainty, and also I saw some places where it was about trade-offs. And that are also parts of the work at SMDM, uncertainty and trade-offs. It's key to provide the evidence along with the related uncertainty, like, provide ranges rather than precise predictions. Equally important, the dealing with trade-offs. So, for example, how many school months of a child are we willing to give up to save one life year of an 80-year-old person? What do you think should we do? How should we move forward with both integrating but also communicating these issues about uncertainties and trade-offs?
I mean, I think we have seen that a crisis situation like this always asks for very difficult decisions. And that you mentioned is something that one should not need to weigh against each other. I think the one starting point is to, as usual, openly discuss that we have to have here some difficult decisions. It's in the end, it's based on values. These decisions are based on values of a society and cannot be imposed. I mean, in the moment you impose it, you have the unrest, you have the non-compliance and the mistrust. So I think the only way forward here is really on an open discussion. Based also now on the lessons learned, what is it that we value more, and how can we get to a point where we may not have to make so stark decisions?
Thank you. You also addressed lessons learned from the collaboration. I remember the slide with all these multiple organizations, the CDCs across the world, and you mentioned not just public health measures, but digitalization, risk management, transportation, logistics, and task forces and labs that must come together. What do you think, or what is your opinion, your personal opinion, that are possible global, I mean, worldwide organizational formats for a future global preparedness of pandemics? Should that be a central international task force or a decentralized structure with, partners? Who should lead such an effort across the world?
I mean,
what would be the hurdles that you would expect for an optimal management and communication, including politics and whatever?
Well, I mean, there are, of course, always political hurdles, but I think in essence, what you describe is enshrined in the mandate of WHO. So if there's a question who should take this forward at a global level, then it should be WHO. On the other hand, I don't think, I mean, there are probably some pillars that same across the world, but then there still need to be possibilities to adapt to a specific context in specific parts of the world. This is the same also to a smaller degree in the EU. I mean, of course, there needs to be some frame that all countries ideally would there be a frame that all countries adhere to, but in the end the local context is very important to make decisions that really fit for local contexts that cannot be done centrally on a global level. So and that is not helping. This complexity is of course not helping that these things are going forward, because I think what we need to discuss and agree upon is what are the elements that where we need a global consensus that they are implemented in a similar way, because in the end what we are doing right now, we are comparing globally. I mean, we're comparing data, we're comparing countries, it has consequences for travel and so forth, and so at least we should aim at having certain elements similar around the world to make these comparisons as comparable as possible.
Thank you, Andrea. I see we have a few questions in the chat. Ursula, do you want to provide, or you can also summarize questions if they bring them all together.
Good afternoon also from my side. People are already active in the chat. Thank you very much. So several people are interested in questions regarding the scientific evidence. You mentioned that complexity reduction and trust is important for information to the public. So is there a system now installed at ECDC to avoid the experience of not so helpful, varied, or also sometimes contrary advice on COVID-19 management strategies, so that in the end, the scientists from the member states, would they first compare their own evidence, talk to each other, agree on strategies, and finally then go to the public and don't contradict each other?
Okay, I think that's wishful thinking, because as you would believe that the science is the same for everyone, the interpretation isn't. And that is in a way also good, because it brings science forward, that there is a discourse on methodology and interpretations and so forth. But in terms of communicating this, it doesn't help. And I didn't mention, because there in my three-tiered lost in translation slide, there is also, of course, the difficulty of science and science to public and policymaker, which can lose the translation because the scientists don't agree. And we have this ample, and I don't think we can avoid that. The most important part would be to have really the transparency where certain conclusions and analysis come from. What we have done here is that for all our analysis, we have made the data sets from which these analyses come available and downloadable on our website, so that whoever would like can try themselves to come hopefully to the same conclusion and the same data that we have.
Thank you. So we also had several questions on communicating that I will try to summarize here. So it's been heartbreaking to see people working 24/7, forgetting family and sleep just to figure out SARS-CoV-2, and yet lose credibility completely because different bodies, persons came out and said something different. So what steps have been taken to regain credibility and trust back? Are we better now at communicating science and health? Do you have any interesting media communication lessons learned? And do you have specific staff training for media communication?
Okay, I start the last one with the media training for staff. We have tried to do some, but we have not systematic. I mean, what we have tried to do here, or what I have do here, is to limit the media communication to a small circle of people, so that at least here the same it's not widely open, but it's still it is true that the communication, as I mentioned in my first reply, is really where it usually gets quite difficult, and the preparedness plans are as good as they can be. Usually it fails with the communication, and it's very difficult to align, to in particular also under the pressure to take the time to sit together and say, well, what is it now important to get across? I mean, that was for us the same. Now we are trying to discuss key messages actually before we come up with the report, so that it's clear for us what is it that we want to communicate. And not that we read the report and then say, okay, what is the summary of this? Because it's very important that communication is also seen as a strategic tool that can help or hamper the goals and the strategy that you want to achieve.
Thank you, Andrea. So Uwe, do you have a last final question for Andrea?
Well, Andrea, maybe if I can ask you a more personal question. You already mentioned the pressure and being on the spotlight, the media requests, mismatch of expectations, lost in translation. So it sounds like you only can get a hard time when you are in such a position. So my question would be, feel free to answer that in your way, how the COVID pandemic affected your own life, not just the the organizational life as ECDC director, but also personally, because you get personal reactions, and this may be very valuable for our SMDM members and participants, as many of them are involved in these boards and task forces and give advices publicly. And we've seen that ranges from excited to exhausted. So what would be your key advice that you learn from this to strengthen our scientists when they confront their first, maybe their first public storm as a reaction to their statements, to their papers, or whatever they gave? Is there something you can give to our members?
Well, I don't know whether this is advice that is applicable for everyone, but I can only say how it was for me, that already at the very beginning, I think when it became clear that it will be a long ranging crisis. And when it was clear that we were asked things that we couldn't do or reply to because we didn't have the information or the evidence, where I said to myself, okay, whatever I do in the coming period, I want to be able to the mirror and see my face. So really to be able to look myself in the eyes. The other part was that the exhaustion is a constant part of my life. It's a part of the life of the colleagues here. What keeps us going is that all of us have joined ECDC for just such a situation. So in that sense, the past 1.5 years really united us also in a common purpose. The other thing is that I always said what we put down in our advice documents, we also have to live ourselves. So if we say people should work from home, then we work from home. I hate this because I think it's an intrusion into my private life, but I work from home. Except for today, where I'm here to have this meeting, but it's the same with a face mask, with distancing. And privately, my family lives in Germany. I am here in Sweden. I have seen them last year once. So that was last year in August. And I haven't seen them for Christmas, and I haven't seen them for Easter. And my father has now his 90th birthday, and I'm determined to go there.
Thank you, Andrea, for this personal insight. I like the, live yourselves and the motivation why we are all in. I think many of us share that. Public health, modeling, communication, all this is part of why we are doing all this. Last quick question and maybe short answer. How can we scientists, experts, communicators from patients and public, from networks and society like ours, including the Society for Medical Decision Making, how can we be optimally integrated in serving this big goal of optimizing public health with all the aspects we have, the science, the communication, all the knowledge, the expertise we have?
Yeah, that is something that we really need to discuss now, how we can do this, that in the event something like this happens again, that we don't happen to find each other after some time, but actually can start putting together our brains from the beginning.
So we will keep in touch with you and hoping for your advice, how the society can serve the CDCs around the world, and particularly the European CDC. Thank you so much, Andrea. We would like to continue, but time for that part is over. I'm deeply thankful for this insight, this presentation, your personal words, your advices, and your clearness and honesty in terms of what do we know, what do we not know. Thank you so much for joining us. I know you have your next meeting immediately after this one, and we were really very happy and honored that you joined us. Thanks so much, Andrea. You will hear more from us. Thank you so much.
Yes, it was my pleasure, and I would be happy if we stay in contact.
Thank you. We will, I promise. Bye-bye. Great. I hand over now to Silke, who announces the next part of our event. Silke.
Yes. Thank you, Andrea. Now it is my great pleasure and a huge honor for me to introduce Professor David Naborro to you. Professor Naborro is the co-director of the Institute of Global Health Innovation at the Imperial College London. With a background in medicine, he has worked in over 50 countries in hospitals, governments, universities, in UN programs for the British government and for WHO. David's focus has always been on disease outbreaks, health systems, food insecurity, climate change, and sustainable development. Since March 2020, David is appointed Special Envoy of WHO Director General on COVID-19. Unfortunately, David is unable to be here with us live, so he has sent us a video message. We are very grateful and proud that he took the time to record this video for our spring event today. So let's watch the video together now.
Thank you for your invitation to provide this keynote speech at today's really vital event. And I'm super pleased to be able to contribute on how COVID-19 has really highlighted the importance of science in public health decision-making. Actually, I've always believed that science as a way of thinking and a way of working is absolutely essential when tackling complex crises where multiple trade-offs have to be brought into the viewfinder. In fact, I'd quite like science to be a verb. I'd like there to be a discipline called sciencing. And by sciencing, I mean the capacity to test hypotheses about what's going on in the world, and then to advance knowledge through finding that the hypotheses we have need to be adapted to try to explain what we find through investigation. And I've always thought that that process of sciencing is one of the skills that actually is really innate to the human psyche. And it's a skill that really marks out humanity as very different from, I believe, how other species work, though there may be more to be discovered on that. And I would like us more and more to be able to share with colleagues that to science is about testing hypotheses, to science is about being okay when you find that you're wrong. And actually being a scientist is not about talking the truth, but instead is about explaining the hypotheses on which you currently work, and then also being ready to find that your hypotheses need to be adapted to the next information that you've received. And so sciencing is vital, especially in the context of an unfolding situation characterized by uncertainty. There are indeed big uncertainties in relation to the pandemic that have to be taken on board. Now, the whole process of managing uncertainty and using science to help with managing uncertainty is particularly challenging because really we just don't know the basis under which we have to make our decisions, particularly when it comes to trading off the outcomes of taking one decision versus the outcome of taking another decision. And so that's where it really matters to have expertise. Expertise helps you to deal with uncertainty, to make decisions in the face of uncertainty, and to interpret the science that applies when you're in a situation of uncertainty. You rely on experts to help you make the best possible sense of an uncertain situation. And that's why we have a World Health Organization. It brings together the best of expertise in public health. It allows those experts to work together in situations where they're able to develop ideas and establish propositions without all the time being fearful that these are going to go straight in the newspaper and lead to a lot of anxiety and even excitement. Instead, you have to be able to deal with that uncertainty in a relatively protective environment, because then you use that analysis of the uncertainty and your reflection on what you think is likely to be happening as the basis for the hypotheses for sciencing. And there's been an awful lot of that in this pandemic, and there will continue to be, because everybody, you know what I know, but I just want to absolutely make certain that you share it with everybody else. This pandemic is by no means over. No means at all. It's still what one might call a raging pandemic, and it's causing enormous suffering all over the world, particularly in poor countries. And it's mutating and it's forming variants, and those variants can in turn cause further problems. They can even evade the protection offered by vaccines. We haven't got that proven at the moment, but my hypothesis is that vaccines that are capable of evading the current, the variants that are capable of evading the currently used vaccines are going to emerge, and they are going to cause continuing outbreaks. And this pandemic is going to continue to advance, even in places that are highly vaccinated. So what does that mean? What am I asking of scientists? What am I asking of decision makers? First of all, please, as public health decision makers, continue to focus on risk. Remember that we're making decisions about relative risk, and that these involve really careful trade-offs. And that if I'm correct in saying, as I often do, that the virus is the problem and the people are the solution, that we're actually asking people to become their own risk managers. And we're asking people to make decisions based on uncertainty. And therefore, we're inviting people to become scientists themselves, because they'll have to be able to think through the possible way to work in different settings. They'll have to develop their own hypotheses. And you might say, well, that's just not fair. Surely what needs to happen is the government will decide, and then people will do what the government decides. But what we've seen is that actually governments do best when they level with their populations what the situation is. They level with them what they understand the risk relationships are. They level with them on the kind of trade-offs that have to be made. They level with them on the status of the science, and they then say, well, actually, you need to be partners in this. You are part of the solution. So moving on from this, I thought it might be helpful to you if I just tell you where the science has taken us so far. First of all, it's telling us that we've got a disease that is indeed infectious. It's very limited fatality rate, but it does have the capacity to cause a nasty long-term infection that can have consequences that will last for several months. And so it is important that we build into all societies right now the capacity to detect and then contain spikes of disease, and then the capacity to prevent the emergence of outbreak surges that can cause high levels of suffering and death. And we have an emerging consensus on how to do this among public health professionals. The basic requirement is to get everybody everywhere to know the actions that they need to take, particularly in terms of physical distancing, mask wearing, practicing hygiene, isolating when sick before testing, and looking after and shielding those who are most at risk. And that is the basis. And what we need now is public health systems everywhere, well distributed across society, that can support people as they themselves make their decisions about how to behave, and public health services that can actually then take action if a spike turns into a surging outbreak and threatens the health services. You've possibly got quite high incidence in the population. Then you need to have government services, local authority-led supported from the national headquarters, that can provide a combination of data together with understanding of the social organization in the area and how people move around, together with an assessment of whether or not there is an increasing incidence and where that is going, so that taking everything together, you've got the necessary information available at the local public health level for the action to be taken. And you don't need to be faced with this false dichotomy of should we prioritize public health or should we prioritize the economy? WHO is clear. The economy will not be right unless public health issues are properly managed. And so data are key for decision-making in relation to public health. The essential effective response capacity has to be available everywhere. And then the decision-making ability in order to be able to look at the data at the local level and decide how best to respond, that is the key requirement. Unless you have the data about where the virus is and how it's behaving, doing a well-organized local response is really, really difficult. 2 other points before I finish. Remember, COVID is hitting poor people the hardest. It's hitting them where they live, and it's hitting them indeed in the places where they work. So we must tackle the inequities and build it into our decision making. Secondly, and perhaps most importantly, a coordinated, government-led, stakeholder-articulated, whole of society response is the key. Remember, the virus is the problem, people in their societies is the solution. And so ensuring that people through their local institutions, their local organizations, local government are able to lead on the response is key. And at the heart of this is science and the data that scientific approaches generate. That really, when put in the hands of local decision makers, is the key to getting on top of COVID and having lives and livelihoods where we can enjoy and earn and live and love. That is the future that we all want, and data will help us get there. Thank you again for the chance to be with you today, and I very much look forward to the results of this meeting.
Thank you so much, David Naborro, for your very interesting thoughts and insights. We will have a 15-minute break now, so please stretch, jump up and down, have a glass of water, and we see you back here in 15 minutes.